Alright, so this is my patient Brittany. ID number is 3087. Today's date is Tuesday, November 22nd. She is a 23-year-old female with no chief concerns. So our patient today presents with nutritional counseling. So thank you, Brittany, for taking part in our 5-day nutrition journal. So I just want to go over a few things with your medical history. You did state that you were taking no prescription medications.
That's correct, yeah.
Alright. So some of the barriers that you noticed with this 5-day diary is that you don't have enough time to meal prep or to make meals or to eat the proper foods that you need because school seems to be very stressful on you.
And I hate grocery shopping. I can't do it.
Okay, yeah, well we're going to talk about more of this later. So when we did your EOIO assessment, we found that you have no nutritional deficiency signs, which is really great. So I just want to talk with you about a few things. We did determine that your caries risk is moderate, and because of that, we put you as that classification because you seem to sip on coffee throughout the day, and you have about 5 cups with cream and sugar involved in that. However, you do use sugarless sweetener, which is good, but you do use 1 ounce French vanilla creamer in every cup, and so sipping that throughout the day can lead to some acid attacks, and we'll talk about that further later. With your appointment today, we did discover that you had a plaque index of 50%, which is higher than we'd like. We'd like it to be ideally at 0, but we know that your appointment is at 3 o'clock, and you probably haven't brushed since this morning. So we did notice when I was looking at your diary that you are deficient in all of the categories, which follows fruits, vegetables, grains, protein, and dairy. So ideally we want to get those up to the ranges that are adequate for the amount that you need. So what I would like you to do is add at least 10 more grams of protein to your diet every day, as well as adding more carbohydrates and dietary fibers, because you're deficient in all of this. While adding those carbohydrates and the foods that you'll need, you'll have a better intake of vitamins and minerals by adding more fruits and vegetables as well. So we'll talk about that more later. So what happens is a lot of your carbohydrates, I did notice, are like softer foods, such as breads, which can lead to having sticks to your teeth more. So for that, I would recommend you using sugar-free gum throughout the day, or after you eat those soft foods on your breads, because they can stick to your teeth more frequently, and you want to make sure you get that off.
Okay.
So you said that you drink coffee throughout the day. My recommendation for that is that you either rinse with fluoride or just water ever so often throughout the day, just to kind of get that acid attack off. So what happens is every time you drink your coffee, 1 sip can cause 20 minutes of an acid attack on your teeth, and having that attack, can lead to harmful decay to your teeth if you keep it up. And then the solid foods that I was referencing, the soft breads and stuff, can stay in your teeth for 40 minutes after you eat that. Yeah, so you want to make sure you get that off your teeth as soon as possible.
No kidding, huh?
Yes, so I'm just going to show you off my flip chart. So what happens is you need microorganisms, your karyogenic diet that we're kind of talking about, salivary flow that helps resist the cavities, and then having a resistant tooth. You need all 4 of those factors to lead to a cavity. So if we can eliminate some of those, it can help reduce your risk of having that cavity.
Because I have all 4 right now?
You have good salivary flow, but your diet, because you sip throughout the day and you eat those soft breads and stuff, can lead to,
So it's a concern.
It is right now, but
Right.
we're gonna get you a good goal of maintaining good oral health, and we'll work on that. Alright, so like I said, sipping in your coffee, try rinsing after it, and also it'd be nice if you could eliminate the creamer as a whole. So if you could try to just do the sugar-free sweetener, and just the coffee alone can help with that. Yeah. And like I said, the sugar-free gum can help eliminate some of those options. You could use is, I know, Trident, sugar-free, and icebreakers. The cool thing about icebreakers and stuff is that they have this thing called xylitol in it, which helps your teeth too, so that's good.
Okay.
There's plenty of benefits for it. We also did state that your period class is a class 1, which is really good. I'll show you here in a minute. Alright, so here's a healthy mouth right now. Your bone level is good, your attachment's really good, your gums look really healthy. So we want to maintain this.
Okay.
However, if you don't get the sticky carbs and the bread off your teeth and you keep sipping throughout the day, you can get like a buildup on your teeth and under your gums, which can lead to unhealthier gums. They can be redder, bleed when you brush and floss easier. The bone, however, is really good. This is reversible. So if you ever get to this point, we're going to try our hardest to reverse it back to healthy gums and teeth. However, it can lead to further problems if we don't maintain your health.
Okay.
Mm-hmm. So with this reading on bone level and stuff, it's important that you have more protein in your diet that repairs and grows your body tissues better, so it can maintain your healthier mouth. You're deficient in vitamin A, which helps the salivary flow, and like I said, that helps against cavities because it kind of lubricates your mouth. And then you also are deficient in vitamin D, which helps the absorption of calcium for bones repair and growth. So yes, and you really need the calcium because it helps like keep your teeth strengthened, and we want to make sure that those stay healthy for as long as we can.
Okay.
So some alternatives that you can eat for when you're sipping and all your breads and stuff, because you're deficient in all of them, we want to make sure that you have chicken, maybe carrots, apples, milk for your dairy, and whole grain toast can help just higher your intake for an adequate amount.
Okay.
So a goal I'd like to see you do is try to eat more in each category, less fats, and then start rinsing after you eat your coffee and stuff.
Okay.
So it can reduce like the staining that you have in the back of your mouth and stuff. So we really want to work on that. Do you have any questions so far?
Mm-mm.
All right, then. Question for you then would be, how can you cut down on sugars in your coffee?
I can stop putting creamer in my coffee.
Okay, yeah, that's a great one. And then what can you do to get rid of the sugars or acids in your mouth after you eat and drink?
I can rinse my mouth out with water or chew some sugar-free gum.
Okay.
Or even brush.
Yeah, that's really good. Yeah, those are awesome. So yeah, if you want to make some of those a goal as well, is reducing that cream in your sugar, trying to sip on it, not throughout the day, but only at meal times can also help. And then try to, like we said, rinse. And so
Okay.
that's all I have for you today. Thanks for coming in.
You're welcome.
Turn that off.